Human Growth Hormone, somatreopleopin. This is the biggest, absolutely with no doubt, most used anabolic agent in the world. It's used across the board, from anti-aging all the way through into professional bodybuilding, not to mention other sports. It's used by women equally as much as men. We see this classically in the literature, abused by bodybuilders, strongmen, powerlifters. Now we see it used by Major League Baseball, NBA, NFL, NHL, Olympians, NCAA competitors. This is across the board. This is not an anabolic steroid. This is a growth factor that I will discuss today. The testing for this by the doping agencies is very unreliable, although they'll say it's reliable, but it really isn't. And there's even lawsuits. So what's happening now is they're testing out of season, and there's a lot of ethics on this. This is going to be big today and in the future. The science of human growth hormone. Where are we? This is a natural peptide secreted from the anterpituitary of all people, both men and women. It's not an anabolic steroid. It's secreted into the bloodstream in a pulsatile circadian manner, and it's influenced by many, many factors: age, sleep, diet, exercise, medical conditions, disease states, environmental and psychological states. Natural human growth hormone exists as a complex combination of different molecular forms called isomers. The major isomer is a 22 kilodalton form. This is the one that's secreted into the circulation. It has a natural half-life of 10 to 20 minutes. This is compared to the pharmaceutical produced agent that has a half-life of 4 to 5 hours. Human growth hormone has direct and indirect effects on cellular metabolism. The majority of the effects are mediated through insulin-like growth factor 1 that's secreted from the liver. The history of human growth hormone. First, human growth hormone preparations were derived from cadavers in 1958. And then in 1985, this was banned because of a central nervous system disease called prion disease, otherwise known as the human mad cow disease. There was approximately 50 cases that can be traced to giving someone cadaver-derived human growth hormone. Very rare. In 1985, the FDA in America approved the first synthetic type of human growth hormone, able to be given to people without contamination because it was produced synthetically. The name of this was Somatrem by Gentech. Now, this was a slight molecular isomer form that was not identical exactly to human growth hormone naturally. So there were some properties of this that were not completely identical to natural properties that we would see from human growth hormone. And in 1987, with the onset of recombinant technology, there was a fully pure synthetic derivative isomer of human growth hormone that was produced by Kabi Vitrum out of Sweden, somatreopleopin. And here we have it today. Now, since that time period, we have 6 brand names, at least in the world. I will not state them. It's clear and they can be researched. In addition to this, we have many, many underground labs. Now, the amazing piece that I've learned on this as the anabolic doc and having hundreds, thousands of anecdotal stories from men, is that this is easily and commonly counterfeited. And the most common counterfeiting agent is human chorionic gonadotropin, because it looks exactly the same as far as the way it's produced, where it's a freeze-dried powder that has to be reconstituted with bacteriostatic water. So the amazing stories I've heard is that patients, knowing this from the underground, will take the medicine at night, and the next morning they will take a simple pregnancy test. These are men taking a pregnancy test, and if they're positive, they're probably not pregnant. They've been given bogus human growth hormone. Amazing histories. Medical use, real legitimate medical uses for many, many decades now of human growth hormone. Number one is going to be with children. Short stature of childhood. Around 12 or 13, maybe 14, a child is going into puberty and he's not had a growth spurt that should be appropriate for his age. Brought to a pediatric endocrinologist, evaluated, and can be placed on growth hormone. It does work, and it does save the quality of life for people, and that's an amazing utility of this drug. Other legitimate uses of human growth hormone: AIDS cachexia, absolutely. Panhypopituitarism, when you have damage to the stalk of the pituitary or to the hypothalamus from traumatic brain injury. You'll have an issue, a scenario where you'll have the anterior pituitary will be down with growth hormone, thyroid, FSH, and LH. And that's classic panhypopituitarism. I've seen many cases. Also, interestingly enough, short bowel syndrome can be treated with human growth hormone, and also severe chronic kidney disease. The benefits, scientifically, and the truth of human growth hormone. There's no long-term data on this. There are no studies. I've searched. I have heard, and I will utilize for this video, up to thousands of patient histories and anecdotal stories. The benefits of human growth hormone are truly secondary to the effects of cellular metabolism. Number one, without doubt, it's going to be on fat loss. Lipolysis, where the visceral fat, it does take time, will be burned off, depending on the person, depending on the use, depending on other drugs. It does work. It burns fat classically in the visceral cavity in the abdomen. Number one. Number two, it is anabolic, although it's weakly anabolic compared to anabolic androgenic steroids. It does have effects on skeletal muscle. It has effects on bone, soft tissue, tendon, ligament, collagen synthesis. Definitely it will be used for recovery and strength after surgery, and many, many documented orthopedic surgical reports. Now, the interesting piece anabolically is that it leads to hyperplasia in addition to hypertrophy of skeletal muscle, where the muscle cell itself grows. In addition, it recruits satellite cells, and that's hypertrophy. It's absolutely incredible. In addition to the benefits that sometimes can be risks, you have carbohydrate effects and metabolism and minimal metabolism. This is a classic diabetic agent where it will impair the effects of insulin. Now, for someone who is in a starving or a postprandial state and is using it for energy production, it's something that's good. But we'll see in the risks that it can be bad in regard to increasing glucose overwhelmingly and causing full-on diabetes. Central nervous system effects across the board in well-being, mood, sleep, energy. Now, one amazing contradiction to this was a large study at least 10 years ago in the Annals of Internal Medicine, where they agreed with some of the anabolic and fat-burning properties, but they showed a paradoxic somnolence, a paradoxic effect where people felt tired with using real human growth hormone. But if you hear the anecdotes, people will say they feel focused, they have increased cognition, and it's interesting that this agent, apart from anabolic androgenic steroids, really doesn't have an effect on sex. Although people will say that it does, but it's not going to be a great effect like real anabolic steroids do. And it's interesting that there's a minimal to no withdrawal syndrome from coming off of human growth hormone. This is the data. The risks with human growth hormone. Again, there's no data and there's no long-term studies. Again, this will affect directly on cellular metabolism. We have to look directly at two disease states that are related to excess human growth hormone production in two disease states called giantism of childhood and acromegaly, when someone from the ages of approximately 30 to 50 has an increased pituitary output naturally of human growth hormone. The disease states are going to be twofold: heart disease and diabetes. It's interesting that when patients are treated and they're minimized and they block the effects of excess human growth hormone, they'll have a normal lifespan. Otherwise, lifespan is cut by about 10 years, and that's straight out of evidence-based data. You can imagine that the risks across the board by people, millions, tens of millions of people that are using this drug, are going to be dose-dependent and person-dependent. So there are the risks. Number one risk that I see, it's across the board on the heart and the metabolic aspects, with diabetes potentially worsening and heart disease, growing the left ventricle, and potential progression of endothelial plaque. Next, equally as concerning, equally unknown with no studies, cancer. Now, cancer by definition is uncontrolled cellular growth. It's a multifactorial process, as we know. Imagine a person has a predisposition for cancer, or they actually have cancer cells when they start human growth hormone. And remember, human growth hormone is used for a very long time. It does not work immediately. It takes a lot of time for this to have an effect. People will stay on this, if they can afford it, for months, if not years. Now, anecdotally, what I've seen regarding the cancer that we have no data for, and I'm not trying to scare people, I'm simply presenting the facts of an expert that's decided to focus his medical career on performance-enhancing drugs, anabolic steroids, mainly for men. I've seen men have leukemia and lymphoma, and these were men that were in their 40s. They were using anabolic androgenic steroids for personal reasons, mainly for bodybuilding, and these were not top professional bodybuilders. And they had lymphoma and leukemia. I remember these cases very well, several cases. Well, one of the patients was so depressed and felt so guilty that he caused this upon himself that I called his doctor at Sloan Kettering in New York City, one of the best cancer centers in the world, and I asked this doctor, "Hey doctor, is this possible that this man's B-cell lymphoma was caused in some part by the growth hormone use?" And the doctor said to me, "We have no idea, Tom, Dr. O'Connor, we have no idea." So I reported that to the man, and I eased him down because we don't know. But what the doctor said to me was, what we're concerned for is that this is a growth product, it's a growth analog, and it stimulates the increase in IGF alpha, which is a surrogate marker for cancer. That's why labs and doctors look at IGF-1, at least from the hematological cancer standpoint of studying. So that's a worry, that if you're constantly increasing IGF-1, constantly for years, you're going to have a great effect, obviously in the muscles, maybe the CNS, but what is it going to do to a potential for an organ cancer? What organ cancers and what cancers have I seen that men have felt tragically guilty that they've caused upon themselves that we have no data for? Melanomas, esophageal cancers I've seen, brain cancers, many. Heart tumor, I saw one heart tumor. I saw a GI cancer, a small bowel cancer called a carcinoid tumor. And all these men were using human growth hormone in addition to other steroids for many, many years on and off, and they were concerned that possibly the growth hormone caused it. Remember Lyle Alzado? He thought that steroids caused his brain tumor. We have no data for that. And God bless Lyle Alzado. Risks continued. Thyroid. Very interesting that human growth hormone will decrease somehow the conversion of T3, which is the active component of thyroid metabolism. It happens in a dose-dependent fashion, and we don't know fully about this. And I've rarely seen this, and I'm not sure I've even ever seen this, because I've checked many men with thyroid panels while being on and off growth hormone, and I can't see that I've seen this, but this is for the presentation today. Carpal tunnel syndrome, without question, is an effect from human growth hormone. It is a metabolic effect on the carpal bones in the hand and directly on a median nerve neuropathy. And this is the median nerve that affects the thumb and the two fingers classically, and it will cause a severe numbness. Now, the anecdotes for this are amazing, that men will purchase underground human growth hormone and they'll tell me, Doc, I know it was real because I dosed it upward until I received and started having symptoms of carpal tunnel. That's amazing. And that's the anecdotal truth. Now, the risks versus anabolic androgenic steroids, a lot of people ask me. It's not an anabolic steroid. There'll be no hair loss, no virilization. This is why women like this drug. There'll be no acne. There'll be no gynecomastia. There's no inherent that we could see GI or liver toxicities. There's minimal to no edema, and I don't see an effect on blood pressure. Another inherent risk of human growth hormone use is the cost and the fact that you have to use it for years. This could cost up to $4,000 a month, even for someone who is using anti-aging amounts of growth hormone. Next, and to close the risks, polypharmacy. So, classically, what other drugs are used with human growth hormone? Number one is going to be insulin, without doubt. Insulin is used most commonly with human growth hormone. Now, this is getting into the professional and the extreme strength and bodybuilding sports. Two mechanisms in why insulin is used. Number one, it will combat the impairment of insulin sensitivity. Number one. Number two, it's anabolic in that the theory is that it does two things. It increases the IGF-1 receptor upregulation, and it decreases IGF binding protein 1. In the end, this will upregulate and hopefully lead to increased anabolism in the skeletal muscle when insulin is used synergistically with human growth hormone. Thyroid preparations, obviously, T4 and T3. More T3 is used because, again, this is an agent that we consider could be blocking the effect of conversion naturally T4 to T3. T3 is the active form of thyroid preparation. Anabolic androgenic steroids. Apart from insulin, this is what's used together. People use anabolic steroids, growth hormone, and insulin. So there are many, many different steroids, and you can see all those videos. But in the end of the day, people use anabolic steroids and growth hormone together. Some of the more esoteric polypharmaceutical agents that I see, Metformin. Metformin is used, obviously, to combat the impairment of insulin sensitivity. And the concerning risks that I've seen are going to be secondary to the metabolic interactions and potential for increasing lactic acidosis and renal damage and renal issues. Now, that's inherent and very rare with metformin, but I've seen it. And I saw one amazing case with a man that used steroids. He used growth hormone for many, many years, and he was using metformin as well, more and more with this polypharmacy. And he ended up having a very interesting, unknown myopathy. He became very weak, and we sent him to 2 neuromuscular experts that actually biopsied his muscle and found some damage on the cellular level to his skeletal muscle. And we had, in the end, no idea what happened. This man has been lost to follow-up with me. I don't know, this is many years ago, what happened to him. I hope he's okay. But we theorized, this man and myself, because the doctors had no idea, that some predisposition using steroids, using growth hormone and metformin somehow led to a skeletal muscle damage on the molecular cellular level. Amazing. Other agents that are used polypharmaceutically, neuropathic mediating drugs, gabapentin, pregabalin are used to combat the carpal tunnel. I've seen this. I see this often. And also non-steroidal anti-inflammatory agents are commonly used. Over-the-counter drugs. Now, this is to counter some of the musculoskeletal effects, maybe the achiness of the joints that may just be from hard training or from osteoarthritis. I've seen cases where men have used all these polypharmaceutical agents together and end up with heart disease and kidney disease. NSAIDs are very dangerous to the kidney, especially with bodybuilders, protein, and hypertension. Please be careful and see those. Now I close this presentation. One of the most amazing studies that I saw that really led me to where I am today on my opinion on human growth hormone is concerning is that looking at the oldest people in the world in a large study, it showed us that these old people that were over 90 years old that were healthy had a inversely low IGF-1. And this was looked at in regard to looking at considering what do we do with growth hormone over years? Do we use it and do we not? How do the oldest people live? So this is the most concerning. We just don't know. I would tell you that I'm very conservative and testosterone replacement is game on for a man that needs it because we have so much data that we know. Of course, we have some data we don't know, but we know that if a man needs it, he can be managed very closely for the side effects with an expert testosteronologist. Growth hormone is very elusive, and we don't have any long-term double-blinded prospective studies. I don't know that we ever will. So I ask you, please, I hope this was educational for you, and I hope you make the right decision with whatever agent you decide to take with your health. Thank you so much. Dr. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button and please subscribe to our channel. And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.